The resurgence of measles in the United States has reached a sobering milestone. With more than 1,000 reported cases already this year, 2025 has now become the second worst year for measles since the disease was declared eliminated in the country in 2000. This distinction, once thought to be a permanent public health victory, is quickly unraveling. And what's especially troubling is that this dramatic rise in cases is unfolding while the nation continues to reel from public confusion, policy shifts, and deepening mistrust in traditional vaccine guidance. The Centers for Disease Control and Prevention, CDC, and various state health departments confirm that at least 1,002 cases have been documented so far, a number that continues to climb. But even this figure may vastly underrepresent the real scope of the crisis. Experts have repeatedly warned that many cases are going unreported, especially in rural or under-resourced areas, making this outbreak not just a public health failure, but a data failure too. The outbreak, centered in West Texas, has spread across state borders into New Mexico, Oklahoma, and potentially Kansas, indicating that containment measures are either ineffective or not being enforced robustly. The implications of this unchecked spread are dangerous and far-reaching. Measles is among the most contagious viruses known to medicine, with an infection rate so high that one infected individual can spread the virus to up to 90% of nearby unvaccinated people. Despite this well-documented risk, 2025 has already matched the death toll of the last 20 years combined, with 3 measles-related deaths so far. The rising hospitalization rate, currently estimated at 13%, underscores the disease's severity even in a high-resource country like the United States. These are not mild cases or mere statistical curiosities. They represent real people, many of them children, whose suffering and, in some cases, deaths were entirely preventable. This year's outbreak has shattered the illusion that measles is a relic of the past. For decades, vaccination efforts kept the virus at bay, and annual case counts remained under control, averaging fewer than 200 per year. But 2025's numbers are an unmistakable indicator that complacency, vaccine hesitancy, and misinformation have reversed hard-won progress. Only about 4% of current cases occurred in individuals who received even a single dose of the measles, mumps, rubella, MMR vaccine. In other words, more than 95% of infections have occurred in unvaccinated individuals, many of them due to personal belief exemptions, ideological opposition, or logistical barriers to care. This pattern is not only predictable, it's inexcusable in a country with widespread access to vaccines. What makes this even more infuriating is that measles is entirely preventable. The MMR vaccine is over 97% effective when both recommended doses are administered, and it has a long-standing safety profile backed by decades of global data. Yet, despite the overwhelming evidence supporting the vaccine's efficacy and safety, some political leaders, cultural influencers, and even members of the medical establishment continue to cast doubt on it. These voices, amplified by social media and populist rhetoric, have contributed to a new generation of vaccine skepticism that is now bearing fruit in the form of epidemics that should never have occurred. The CDC's decision to stop reporting state-level case details only adds to public confusion and suspicion. Lack of transparency in a moment like this does not foster trust, it breeds it. People deserve to know where outbreaks are occurring and how extensive they are. Shielding this data behind bureaucratic silence risks allowing the virus to spread further, especially in regions with low vaccination rates. The opacity also hampers the work of local public health officials, researchers, and community advocates trying to mount an effective response. Policy failures at the national level are compounding the problem. Despite the outbreak, there is little coordinated federal guidance or enforcement. At a time when clarity and leadership are urgently needed, the absence of a strong, unified national response is glaring. The recent comment from Health and Human Services Secretary Robert F. Kennedy Jr. suggesting a reevaluation of measles treatment protocols, rather than doubling down on proven vaccination strategies, are deeply concerning. At worst, Such proposals signal a retreat from evidence-based policy in favor of political appeasement or pseudoscientific pandering. The West Texas outbreak has become a symbol of how rapidly measles can gain a foothold when herd immunity drops below safe thresholds. But the problem is not geographically isolated. States like Ohio, Montana, and Michigan have also reported clusters of cases, some with over 30 infections each. If transmission chains continue unchecked, it is very possible that 2025 will not only surpass 2019's total of 1,274 cases, but could mark a full regression to pre-elimination levels of measles incidence. The cost of this failure will not only be measured in case numbers and death tolls. It also sets a dangerous precedent that preventable diseases can and will return if vigilance wanes. The erosion of public trust in vaccination, fueled by a chaotic policy environment, incomplete data, and political interference, has created fertile ground for outbreaks of diseases that were once all but eradicated in the developed world. If measles can make a comeback, what about polio? What about diphtheria? This crisis is a wake-up call. The United States is no longer insulated from the epidemics that vaccines once rendered impossible. The choice to act, or to continue delaying, will determine whether the nation recommits to the fundamental principles of public health or slides further into a future where once vanquished diseases return with a vengeance.